Hi guys, good day to everyone on my TikTok page. My topic today would be about mental health. In the past, I have talked and spoke about several topics in relations about mental health. Today, I would like to talk about mental health again. Okay? And the reason why I would like to talk about mental health, it is very much pervasive and prevalent in today's world. And some people overlook mental health. They overlook people who are diagnosed with mental health. Mental health can sometimes be seen as a stigma. And I want to bring awareness to people in society, letting them know that if someone around them or even you yourself is experiencing some form of mental health, is to seek help. There are help out there. There are institutions out there where you can contact or where you can go to and make some form of an appointment. Mental health can be treated with medication by a psychiatrist, and it can also be treated by having therapeutic help with speaking with a clinical psychologist. Mental health can be referred to as emotional, psychological, and social well-being. Some people experience a dysfunction in their brain. Some of these dysfunction, it can be an imbalance, in some form of imbalance in their brain. Okay? Now, there are several mental health disorders. Some of the more well-known mental health disorders are anxiety, depression, schizophrenia. Some of them are the more prevalent and the more well-known mental health. But mental health is a broad spectrum. It is a broad spectrum which have several disorders. Mental health can be substance abuse. Abusing substance such as alcoholism, abusing narcotics, simple as someone overdosing themselves with oxycodone, abusing the meds, not taking the meds as the way it should be taken, as the doctor ordered the med to be taken every 6 hours as needed. Some people abuse oxycodone. Every time they feel pain, within every hour, they take oxycodone. Substance abuse is also mental health. But in today's world, when people hear about mental health, their minds simply think about bipolar depression, psychosis. They think about that, and they don't think about some people who are injecting themselves with drugs. They don't think about people who are taking psychotic drugs. They don't think about people who are abusing alcohol. I want the world and society and the people on my social media to know, let's remove the stigma that surrounds mental health. Sometimes mental health can involve feelings. It can involve a lifestyle change or lifestyle changes. Now, there are people in society who are diagnosed with a mental health disorder. And if you are diagnosed with a mental health disorder, I want you to know that there are help out there for you. There are help, there are outreach programs, there are institutions that are placed in every community where you can call or where you can make an appointment. There, you should not feel embarrassed to seek help. If you need help, go seek help. Okay, ladies and gents, in the world we live in today, when people say that they are diagnosed with depression or anxiety, there is a stigma. People simply say, oh, they are crazy. No, they are not crazy. Sometimes people experience lifestyle changes, a traumatic experience. Traumatic experience or trauma can be an encounter. It can be a physical encounter, or it can be an acute or chronic traumatic encounter. And we have people in society who experience trauma. Trauma can be passed on from generation to generation. And that type of trauma is called intergenerational trauma. It can be passed on through epigenetics. Some trauma which your great-grandparents or your great-great-grandparents experience, although they have died, that trauma can be passed on through epigenetics to you. So just imagine you have been birthed with a passed down trauma. It has been innate in you, that passed on trauma from the past generation. And now you are living in society experiencing your own trauma. Some people try to suppress the trauma. Some people try to hide the trauma in the unconscious part of their mind. And they are trying to avoid confronting that internalized trauma. We are living in a society today where a lot of people are being overwhelmed. They are being overwhelmed with finances. They are being overwhelmed with the social economic crisis. There's an inflation not only in one part of the world, but globally. In different parts of the world, society is experiencing a social economic crisis. Some people have become unemployed. So we are seeing a breakdown in society. And when there is an issue in society, of course, it's going to affect people psychologically. Okay? But I'm here this morning to let you all know that if you are experiencing some form of depression or some form of anxiety, and you're feeling overwhelmed, and some of these feelings are making you feel nervous, you're feeling panic attacks, you are having sleepless nights, you are unable to sleep, you're able to function, go seek therapeutic help. You don't always have to be placed on medication. You don't always have to be diagnosed with a mental health disorder. Okay? Take care of your health. The past few weeks I've been talking about eating nutritious foods that will sustain you and that will allow your body to consume nutrition. I not only want you to only consume and eat nutritious food, but I want you to take care of your mental health as well. Because your body, you don't only take care of one part or one aspect of your body. You take care of your body in a holistic way. Okay? You take care of the wholeness of your body. Okay, ladies and gents? Now, while I am speaking on the topic of mental health, if you are not experiencing some form of mental health, you may know of someone who is is experiencing some form of mental health. And I want you as people in society, or as individuals in society, to be empathetic to these people who are experiencing some form of mental health disorder. Be empathetic to them. We are living in a world whereas a lot of people, they are very much mean and they project a lot of microaggression. We are living in a world today where everything you hear on social media, you have to do your own research. Because a lot of people come on social media and they speak a lot of pseudo, a lot of propaganda, a lot of anecdotal messages. Okay? Some people are very mean on this social media. They are bullies. And they come on social media and they try to devalue other people by speaking illfully, using derogatory terms against them. We are all imperfect beings. Everyone on this earth, they have something about themselves that is not perfect. And why bully another individual because of their imperfection? Why glorify someone's downfall? All of this contributes to other people developing mental health. When people come on social media and bully other people, when these people read the comments, the hateful comments, it can make them go into a state of experiencing some form of mental health disorder. It can cause them to unalive themselves. I want people to have love and compassion again. People have removed love and compassion from the equation and they have placed hate. Whereas whatever they think it, they will write it. But I want you to put yourself in that person's shoes. And how would you feel if somebody talk about the way that you look? How would you feel about that if someone make fun at the way that you look? How would you feel if someone bullies you? Okay? I've been working in the healthcare field for the past 11 years. And I have gone through school to acquire my credential to work in the job field that I'm working in. But although I know that is a certain level of empathy that's supposed to be shown to myself, to the patient, I still try to be empathetic to these patients. Some people I've worked with in the past and in the present. Some of them, they project very much unethical behaviors. But I myself, I still keep my decorum. And I know to myself that these patients, they weren't always sick or they weren't always bedridden. At some point, this person was walking. This person was walking and doing activities in their daily life. But then along the way, that person got diagnosed with some type of sickness or illness. And now that person is unable to work and they are unable to take care of themselves. So I treat people with dignity and respect. And those are the words that I walk with on my daily life. When I treat others, I treat them with dignity and respect. So therefore, what I am realizing for the past 11 years is that not all the people that work in the healthcare field treat people with dignity and respect. They treat them very much, they treat them very much, how to call it? I'm going to just use the word like this. They are very much unprofessional and very much unethical in the way that they work with some of these patients. Even some doctors in the healthcare field, some nurses in the healthcare field. Why did you take up that profession if you know that you cannot be empathetic to the patient? When a patient is sick and that patient is unable to take care of themselves, the patient not only need medication to make them feel better, but they need to have a nurse that will be very much compassionable and who will be very much empathetic to them. The reason why I said that is this. As of today, where I work, there is a said patient there. And the patient is going through a particular disease. And that said patient, the patient will cry and shout out loud. And some of the healthcare workers, they will complain about the patient behavior. But me, what I will do, I will go to that said patient's room. And what I've been doing, I will talk to that patient. Because I've understood the fact that that patient is sick. That patient is unable to deal and cope with the pain of being sick. That patient possibly have not come to terms of the fact that they are unable to help themselves. Some patients, they have not come to terms. Reality has not hit them as yet. When people get sick and bedridden, they have to come to terms with their new reality. Okay? And what I will do, because I am in the field of attaining my degree in psychology, whenever I see patient like this particular patient cry and give out an outburst, what I do, I talk to them, because I understand that a patient is going through agony, is going through pain. Sometimes the medication will not be able to subdue the pain. Sometimes the patient will need someone to talk to them. So what I will do, I will say, relax, calm yourself. If the patient is overreacting, they need to relax. They need to allow their body to have balance. Okay, it is okay. I let patient know that it's okay to cry. Because when you cry, you are crying out all that pain, that agony. So I allow people and even my patients to cry, because I want them to know that it is okay to express their emotions, and that is okay. But after they cry, I want them to reach to a point of being strong, of being resilient, and understanding that this time is just for a season, and one day they are going to recover from that said illness or disease, and they're going to be normal again. Okay? We as people in society, a lot of people have removed compassion. They have removed that, and I don't know why. I want people to bring back love and compassion to humanity. Stop giving off microaggression. Stop giving out hate to other people. Show love. You want to be loved, therefore project love. Perpetuate love. Okay? While I've been working in this field for the 11 years, I've worked with patients over the years, and I can just give you all a few stories. There was this one time, this lady, she had gotten admitted at the facility where I worked. It was a past facility. It was a few years ago. And she was unable, she did not have mobility. Every time she stand up, she felt dizzy. And I started to talk to her, and I started to encourage her. I started to give her words of motivation and inspiration. I kid you guys not. Within 1 month, that patient started to be strong in mind, body, and soul. And she started to push herself to recovery. That patient was then discharged, and now she lives a normal life. I will give you all guys one more scenario again. I met this patient. He got into a car accident, and one of his feet, was broken. And he told me that he's unable to use the restroom because one of his feet is broken. I said to him, I said, listen, one of your feet is broken and it's not the two. I said, I want you to get up and do not put weight on the feet that is broken, but put the weight on the feet, the good feet. And I said, use that and be strong. I kid you guys not. After the next day when I went to work, I am looking for that said patient. He was already out of the bed, and he's telling me, in fact, he told me call my supervisor. He wants my supervisor to know, because I talked to him and encouraged him and motivated him to use the good feet. He was able to take my advice, use the good feet, and now he can hop on one feet and do things for himself. You see, when you're working in the healthcare field and these patients come in there, they get admitted, they are sick, and they have certain disabilities. We who are assigned to these patients, our job is not only to do their ADLs, active daily living, or to give them meds, but we are also there to help them, talk to them. Some of these patients, they don't have family members. Some of them, they don't have friends. Okay? And the only person who is there around them a few hours of the day is the nurse. And a nurse's job is not only to give a patient medication or to attend to the patient ADLs, but I want nurses out there to be compassionate and to be empathetic to these patients, to show them dignity and respect, because that said patient is someone's mother, is someone's father. Put yourself in that person's shoes. The way you want to be treated, treat them the way you would like to be treated, with dignity and respect. If you see them cry, show them compassion. Don't be treating them illfully. Not because you have a bad day, that means you're going to take it out on them. No. Anywhere I work, if anyone do a background check on me, I kept my decorum at every job. Because patient care is treating patient with dignity and respect, is my number one momentum. Because I have came to understanding that these patients are human beings, and they ought to be treated with dignity and respect. And if I don't treat them with dignity and respect, then what am I doing? What is the reason why I am a nurse? Why did I take that job? For money? Likewise, I want people in society, on social media, to have compassion, to have empathy. Don't be coming on the social media and bullying other people. How would you feel if someone bully you and talk about your imperfection? They talk about the way you look. Huh? How would you feel? Put yourself in that person's shoes. Let's bring back love in society. Okay? And let's stop trying to be hateful. Because people who project hate, they have hate for themselves. Okay? They have hate for themselves. They have a problem. They have an issue. So they have not yet confronted that issue or that problem. They have not yet confronted that hate. So now they want to project it onto others. Let's show love and compassion to humanity. Okay? So I hope you all have a beautiful day. And please, let's remove the stigma that surrounds mental health. And I want you all to know that mental health is not only bipolar depression, it's not only psychosis or schizophrenia, but mental health can be seen as a person who is taking who is addictive to some type of psychotic medication, who is abusing alcoholism. I want you to know that mental health is a broad spectrum. Okay? And you look at mental health in a multifaceted approach. Okay? And remove the stigma that surrounds it. And if you are experiencing some form of mental health disorder, I want you to know that there are help out there. There are institutions out there. Seek help. You can seek help by going through therapy. You can seek help by being prescribed medication from a psychiatrist. And these medication, they will stabilize the dysfunction and the impairment that has taken place in your brain. Because some mental health disorders, there is an impairment, there is a dysfunction, there is an imbalance that took place in the brain. And they need to be treated with medication. So you all have a beautiful day. And just remember, it's not life, and taking care of your body is not only eating nutritious food, but also taking care of your body in a holistic method. Okay, so you all have a beautiful day. Happy Saturday, and bye.